My name is Stefan Kertesz. I'm an associate professor at the University of Alabama at Birmingham School of Medicine and a physician at the Birmingham VA Medical Center. The objective of this study was to understand changes in lung function that occur with increasing exposure to marijuana. As many people understand, marijuana is very widely used in American society and has been for the last several decades. There have been previous studies that have suggested either no harmful effect of marijuana or increases in lung function with exposure to marijuana, and even some studies that suggested harm. We had access to a database that encompassed over 5,000 individuals, followed for over 20 years, who were repeatedly queried about both their use of tobacco and their use of marijuana, and who underwent up to 5 pulmonary function tests. Our interest was to study how pulmonary function changed using 2 common office-based tests in relation to marijuana and tobacco. The sample was over 5,000 individuals recruited in 1985 and 1986. By design, the sample was half black and half white. They were recruited as part of a long-term follow-up of cardiac risk factors that was commissioned by the National Heart-Lung-Blood Institute and has been followed to this day. What we found is that tobacco and marijuana have different relationships with pulmonary function. The pulmonary function measures we used in this study were the FEV1. This is the amount of air that a person can breathe out in 1 second and is considered the equivalent of an airflow rate. The other pulmonary function measure we used was the FVC, or forced vital capacity. It's the total amount of air a person can breathe out after taking a maximally deep breath in. So one is a flow rate, the other is a flow volume. And what we found was that with tobacco, increasing levels of exposure to tobacco were associated with loss of both the flow rate and the volume, and that's very much what you would have expected from all prior studies. With marijuana, what we found is that relationship changed depending on the total cumulative exposure to marijuana that a person had accrued in their lifetime. I'm going to refer to moderate levels of marijuana use. By that, I mean a person who has gotten up to 7 joint years. A joint year is defined as the amount of marijuana a person would take in if they smoked 1 joint each day for a year. I don't necessarily think that it's moderate use to get up to 7 joint years, but that's how we termed it in this study. At up to 7 joint years of exposure to marijuana, there was a tendency for both air flow rates and for lung volumes to increase with increasing exposure to marijuana. That was quite different from what we saw with tobacco, where there were declines in both air flow rates and in lung volumes. After 7 joint years of exposure, the relationship flattened out and the curve began to show a hint of a decline, where increasing exposure beyond that level was associated either with no change or with loss of lung function, particularly with regard to that flow rate. Most people who smoke marijuana also smoke tobacco. So we very carefully constructed the statistical models and the measurements to allow us to analyze marijuana use separate from the effects of the tobacco, which was often occurring in the same individual. When we looked only at people who had marijuana use and no tobacco, we found very much the same patterns as we found in the population at large. First of all, at the levels of marijuana use that are most common among those Americans who smoke marijuana, there's really no evidence of long-term harm to pulmonary function. At levels that go quite a bit higher, there's at least a hint that there could be harm. So in someone who's smoking several joints a day for many years, we certainly cannot exclude the possibility that there's harm to lung function for such people. However, at the lower levels, as I said, there didn't seem to be evidence of harm. Marijuana is a complicated substance. It has a lot of different effects in the human body and on human life. It can affect someone's tendency to get into risky situations. It can affect someone's likelihood of getting into an accident. It can affect fertility. It certainly does have irritative effects in terms of causing cough, and at very high levels of use it may have adverse effects on pulmonary function. I think that it's important to realize that for any substance, it's not good to pin your counsel to a given patient on just one organ system. Previous efforts to look at the relationship between marijuana use and lung function had obtained mixed results. Some had shown hints of harm. Some had shown at least the suggestion that there was an increase in lung function with some exposure to marijuana. What this study clarifies is that it's really a curve, and that the relationship between marijuana and lung function changes depending on how much marijuana a person has taken in over the course of a lifetime. At those very high levels of use, there could be harm. However, at the lower or moderate levels of use seen among those Americans who smoke marijuana, there's no real evidence of harm to airflow rates or to lung capacity. Bear in mind, when we report that there were small increases in airflow rates and in lung volume, these are small increases. A typical FEV1 in an adult male is about 4 liters. That is to say, I can blow out roughly a gallon of air in the first second of expiring. With marijuana, the increase was roughly 50 cc. That's about the size of a small can of juice. I think there remains significant ambiguity about what happens among those people who are heavy daily users of marijuana. And those individuals are very often clinically dependent on marijuana and have other good reasons to stop. However, the effects on their lungs really aren't fully clarified by our study. And those might be effects that could be studied better in a population of heavy daily users, either persons with a defined addiction or a population where marijuana use is very, very common.